Hi, everyone, and welcome to another very special Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer, and in honor of National Physician Assistant Week, I'm joined by 4 PAs within the MedStar Georgetown Transplant Institute: Karen Strenger, Michelle Jenkins, Anna Frank, and Andrea Keller. Millions of Americans visit with physician assistants every day, as they often serve as the patient's principal healthcare provider, offering quality, accurate care, and so much more. PAs are medical professionals who diagnose illness, develop and manage treatment plans, as well as prescribe medications. Today, we'll be discussing the role of the physician assistant, where it originated, what they play, the role they play in medicine, how they're supporting our transplant patients at MGTI, and more. So stay tuned to hear more. Share this broadcast with your friends. Give us a like to let us know you're watching. And if you have any questions for our experts, leave them in the comments below, and we'll get to those during our broadcast. Thank you all for being here today. Before we get started, could you all tell us a little bit about yourselves and the work you do as a PA at MGTI? And Andrea, let's start with you.
So Andrea Keller, I'm a PA. I've been a practicing PA for 11 years now. I've been with the MGTI since 2014, so about 8 years. And I just love what I do, to be honest. I did primary care for a very short time prior to all this, and then went to GI and right over to hepatology thereafter. And I just love the patient interaction we've been able to get. I love the colleagues that I've been able to accumulate throughout the years, and feel, I have a very unique role within the MedStar system, because I actually am the sole provider at our Virginia location in Fairfax, just outside of Inova Fairfax Hospital. So I have been cuddling that since I started, and like I said, it's unique to me. You'll learn from the other girls what they do and what their unique role is, but that's who I am and what I do. Great,
thank you. Michelle, you want to go next?
Sure. So I'm Michelle Jenkins. I've been a practicing PA for 9 years. Went to GW for my PA school education. Started out as a hospital medicine PA for about a year and a half, and then made the switch over to transplant and hepatology, where I've been since. I too love what I do. I think being in transplant and transplant PA is actually really rewarding, and something that I never thought about in my pre-PA education. So I work primarily outpatient. Yes, outpatient. And I do both pre and post liver. So.
Awesome. Thank you. Karen, you want to go?
Sure. My name is Karen Strenger. I'm a physician assistant. I've been practicing for about 9 years now. I also graduated from the GW PA program. My background is in emergency medicine. I started at the Transplant Institute about 4.5 years ago, and I also absolutely love what I do. I'm an inpatient physician assistant working in transplant hepatology. I help to take care of patients with end-stage liver disease, manage the complications of their disease, and get them evaluated and listed for liver transplant. I perform paracentesis. I do some teaching and education. I work very closely with our medical residents and fellows and the rest of the healthcare team. And it's just an incredible opportunity, and I really love what I do.
Great. Thanks for sensing a common theme of everybody loves what they do. So Anna, you want to go last and tell us how much you love your job?
Absolutely. So I'm Anna Frank. I've been a practicing PA for 7 years. I started off my career in general surgery and then moved to transplant surgery. I've been with MGTI since 2019, and my role at MGTI is kind of a split role. So part of my time is spent clinically caring for surgical patients. So whether they've had a liver, kidney, small intestine, and even some of our hepatobiliary surgical patients. So caring for them in the inpatient setting. And then I also have an administrative role in that I manage the inpatient providers. So I have a team of physician assistants and nurse practitioners reporting to me, all of whom work in the inpatient setting. Great. And yes, I also love what I do.
There we go. There it is. All right. Well, thank you guys all again for being here today. Let's go ahead and get into the questions. First of all, let's just start off with, what is the overall role of a PA? And can you kind of go into the difference between a PA, a nurse practitioner, and a doctor? Whoever wants to take it, go ahead.
I'll kick it off, I guess, then. So the overall role of a PA, so PAs are medical professionals. We are trained as such. We're trained under a medical model, who we see patients, diagnose illness, develop and manage treatment plans. We can prescribe medications. In some settings, depending on where you work, PAs can be the patient's principal healthcare provider. Also work in surgical settings, as Anna mentioned. The main difference, we get this question all the time, actually, between PAs and NPs and doctors. Of course, doctors have significantly more training and years of education. But between PAs and NPs, it's really just how we're trained. We're trained under a medical model, whereas NPs are trained under more of a nursing model. But at the end of the day, we function pretty much the same. So we try not to focus on our differences so much because we're both vital parts of the healthcare system.
Yeah, I think that Michelle answered it great. For the inpatient team, for example, and it's like this for across many of our different entities, we have PAs and nurse practitioners operating in the same capacity. So our inpatient team of post-surgery providers is actually a pretty even mix of nurse practitioners and PAs, and we are all operating in the same capacity, taking care of patients after they've had, very complex operations.
Great, thank you. And Michelle, you kind of touched on schooling. So how much schooling does a PA have to complete or before they become a PA? I don't know, Michelle, you want to take that one, or if anybody else wants to?
Well, I just want, I will say there's a couple different paths, and Karen and Michelle might be able to validate some of this since they come from the same program. I come from New York State, and we have the option of doing either just a standard master's program where you get your bachelor's degree in some other capacity, usually the health field, of course, and then you press on to do a master's program thereafter. But the school I came from also had what was a BS-MS program. So it was a total of straight up 5 years. You got right out of high school, you went right to your graduate degree, and you graduated as a full-on PA at like 20 years old. I have an undergrad degree that I did individually. I worked in the healthcare field for a couple of years. I then went back to PA school. So for me, it was a little bit longer. My program total was 3 years, 2 years of didactic or straight in classroom work, and then 1 full year of rotations through all the different medical entities, surgical, some electives that we chose, that kind of thing. I don't know, GW or even Anna, if your program was slightly different, but on average, most programs are, I don't know, what, 21, 24 straight months or something like that.
Yeah. So at, excuse me, at GW, it was pretty much the same. It was, all of us came in with an undergrad degree in whatever field, and then master's degree program and the PA certification. There were 2 tracks at GW, actually. There was just a master's of science and your PA degree. And then there was also a master's of science and master's of public health track that was a year longer. That you could choose to apply to as well. To the best of my knowledge, I don't think that they do. There used to be, like you said, Andrea, where it was like a combined bachelor's. They don't do that anymore. I think all degrees are now required to be master's levels. And I know that there's very few, but emerging PhD doctorate programs for PAs as well.
Yeah.
Yeah, most PA programs are somewhere between 24 and 27 months long now, and it includes both a combination of intensive classroom instruction as well as thousands of hours of clinical rotations. And then the other important thing to know is most PAs have some sort of previous clinical work because, as a requirement to get into PA school, generally you have to have several thousand hours of clinical experience because the program is so abbreviated. I used to be an EMT prior to going to PA school. A lot of my colleagues were physical therapists, nutritionists, medical assistants. They worked in all sorts of different capacities in the healthcare setting to have prior healthcare experience.
Okay, great. That actually, I was going to ask that question. So there you go. Thanks for covering that. And then, Andrea, you mentioned you started off in New York. So can PAs practice in all states and in all types of medical practices? Do you have to be licensed in each state, or how does that work?
Yes, so PAs are actually practicing in all 50 states, including DC right now.
Okay.
Each state has different requirements for what a PA can and cannot do, similar for an NP and even MD providers. You do have to license individually within each state. So for all four of us, we are licensed in Virginia, DC, and in Maryland, because we see patients across all the different borders. The one really nice thing about being a PA and having this quote unquote flexibility is that when you do move from state to state, all you do really need to be is licensed, and then you can find a practice thereafter. We have the ability to do lots of different kinds of medicine, which is super cool, purely because you're not going to school to say, I'm going to just be a family medicine provider, or I'm just going to be an obstetrician provider, or what have you. We do hepatology right now in transplant, but when we decide to have families, or when our children get older, or when we are kind of wanting to settle down and or retire, we can change that and do something a little less aggressive or a less mind-blowing than transplant and hepatology, I suppose.
Right.
And I think so when you graduate from PA school, there is a national certification agency. So all of us sit for an exam that says, that we are nationally certified to work. So then, like Andrea said, you just relate each state that you are working in, you go and get, a license from that state. So I started off my career in Massachusetts. So at one time I was licensed in Massachusetts, and then North Carolina, and now DC. So.
Okay. Great. Well, thank you. So I'm going to take a second and pause and just say to our viewers, if you're just now joining us, thanks for tuning in. This week is National Physician Assistants Week. So today we're joined by 4 PAs within MedStar Georgetown Transplant Institute. Karen Strenger, Michelle Jenkins, Anna Frank, and Andrea Keller. I don't know why I started to say Amanda. And we're discussing the role PAs play in medicine, how they're supporting our transplant patients at MGTI, and much more. So we've got a lot more to cover, so stick around, share this broadcast with your friends. And of course, if you have any questions for our experts, you can leave those in the comments below. So my next question is, how would someone's appointment be different if they saw a PA, or would it not be different at all?
I would like to speak just at least from the outpatient individual, because inpatient's different. And I think
Okay.
Karen and Anna can relate to that. And because of the unique work that we do, I think it's going to be different for every practice you go to and every provider that you see.
Right.
But really, our visits are no different. You still come in, we still do physical exam, we ask all the same questions: symptoms, side effects, medications, surgeries, your family history, your overall history, and really just try to get to know the patient and gather their trust and their relationship so that we can keep a really nice, smooth, management profile throughout. I will say, just from some of the training that we've had and some of the feedback I've received from patients over the years, a lot of our patients do mention that we tend to spend a bit more time with them. Okay. I don't know that that's really true. I really do believe it's provider dependent. So if that provider is invested in you and wants to spend the 45 minutes or more with you, absolutely. If it's a quick appointment and you're in and out and you guys kind of finish it up in 15 or 20 minutes, then that's what was needed. But I feel that we as PAs were trained to look at the whole person. So we do a lot of that kind of medicine. So we kind of head to toe you, we focus in on what needs to be done, but we do spend a decent amount of time with them. And I feel if I were to sit down with a PA for myself and then an MD and an NP for myself, I don't know that there would be a lot of difference logistically. I think it would really be provider dependent. And that's from an outpatient. I see relatively healthy guys on average. If they're post-surgery, it's usually months out of surgery. Nothing's very critical when I see them, to the most part.
Right.
It's the critical visits that I'm sure may be a little different, and sometimes even procedurally a little bit different. But I really think there's very little difference, honestly.
Right. Okay. Did anybody want to talk about from the outpatient or the inpatient side of things?
Yeah, so I think usually, in the inpatient setting, it's a little bit more of a collaborative approach to patient care in that, so for the post-surgical service, for example, each patient, is going to be followed by one of the APPs on our team. So whether that's a PA or an NP. And so we usually go and kind of round on the patients and then, look up labs and, just any prior consults from the day prior, imaging studies that we need to follow up and that type of thing. And then we formally round with our attending physician, as well as typically one of our transplant surgery fellows. And we go and see the patients and kind of formalize the plan and take it from there. So it's a little bit different in that, we're not seeing patients. It's just a different setting from the outpatient setting. And I think, Karen, you can probably attest you are in a similar boat, but I'll let you speak to that.
All of our patients are essentially being seen, in conjunction with the physician, just due to the complexity and the acuity of the care. I guess one added benefit would be you get the advantage of having two providers kind of putting their heads together to troubleshoot and solve problems and work together to create a great plan of care. So if anything, you just get an added benefit from it.
Right, exactly. And I think you guys kind of touched on this a little bit with those answers, but can you talk a little bit more about the relationship between a PA and the MD? Like, do you discuss the patient's care together? You said, talking about collaborating and everything. So can you talk a little bit more about the relationship between a PA and the doctor?
Sure. So I can start addressing that. I think it depends on different practice settings for sure. In transplant, at least in my experience on the outpatient side, which is actually a little different than Andrea's experience being the sole provider in Fairfax, I have my own panel of patients that I'll see routinely by myself that require very little collaboration with the MDs. But then at the same time, I also see fresh discharged transplant surgery patients that I'll need to collaborate with the surgeons on, or if it's a particularly complex hepatology patient, I'll need to collaborate with a MD on. So it's always good to know that there's someone there, someone you can bounce ideas off of if you need to, but at the same time, you maintain your independence, some of your independence as well, in seeing your own patients and going from there.
Great, thank you. So again, I think you all kind of touched on this, but what would the benefit be of someone seeing a PA for their healthcare concerns?
I think Andrea had touched on this a little bit earlier, but one of the added benefits in my mind is, because we're trained kind of as generalists and we train in every subspecialty from pediatrics to geriatrics to surgery to everything in between during our education, we have a really strong foundation and we're able to kind of really look at the whole patient and kind of put everything together. And whether that be, preventative care, management of chronic problems, and also the more acute things. I think that's one of the advantages is that we're really good about looking at the whole patient and, trying to address all the issues.
I think also too, the benefit kind of depends on the setting. So I think for, the inpatient setting, for the post-surgery service, it's the benefit of, we have a team of APPs that provide 24/7 coverage to our patients. Whereas, if there weren't a team of APPs, you would be relying on a team of residents. And the way that residents work in their training is, each month you would have a new resident to the service that may or may not have prior transplant knowledge and experience. So by having a team of dedicated APPs in place 24/7, you really get people that know the care of transplant patients. These are highly complex patients and things can change, in a minute. So it's really beneficial to have, dedicated APPs who know transplant, who know the patients and the care. And then I'm sure Michelle and Andrea, I'll let you speak to the, the benefits in the outpatient setting.
So it is unique, like I said, for me in general, because I am not directly attached to Georgetown Hospital, which is where everybody else is right now. And I am able to provide 5-day-a-week care to any patient within my vicinity or anyone that wants to come to me at any time. on average, and in our situation, which, you know, is MedStar specific, we have a provider or an MD, a medical doctor with me at least 3 days a week, but that's not all the time. And some weeks when they're rounding or if they're on vacation, I am the only one there. So we always try and make sure that the patients that come to the outside clinic very comfortable with the idea of seeing both myself and or the physician. So if there is the instance where the patient needs to be seen, whether it's urgent or it's just about that 4-week follow-up and the doctor's not going to be available for another 2 weeks, they have another person and they know that person who knows their care. So it just gives them more options, more flexibility, availability. And, you know, from, you know, an internal perspective, so from a business standpoint, we actually are able to give providers and medical doctors more time to do what they have to do so that we can still see the patients and still allow the clinic to run smoothly. You know, we are involved in research. We are still involved in procedural type work. We still do a lot of other things than just straight up patient care, but it gives everybody a little bit more time because there's that many more hands.
Right. Thank you. So my next question for you is, you all started off with your introductions talking about how much you love your job. I'm just curious, what made you choose to, you know, become a PA, and what brought you, drew you to MGTI and working with transplant patients? I don't know if Anna, you want to start off this one?
Sure, yeah, absolutely. So for me, I think being a PA, I was intrigued by the flexibility that the career would offer me. I knew that I was always wanted to be or pursue a career in medicine, but I think that the kind of work-life balance that being a PA offers was something that definitely attracted me to the field. I like the flexibility. I like that, you know, I started off my career in general surgery and now I work in transplant surgery. If, you know, in the future I decided that I wanted to pursue another field of medicine, I can do that. And a lot of it's just kind of on the job training, whereas, you know, a physician is kind of locked in. Once they pursue a specialty, if they wanted to change fields, you know, it's repeating a residency and or fellowship. So I love that about being a PA. I think for me, working in transplant, I didn't have a lot of exposure to transplant when I was in school. So when I started working in transplant, I was kind of like, transplant, that seems cool. Wonder what that's about. And then, you know, I've really found it's obviously a highly specialized field, but it's kind of this perfect blend of surgery and medicine. I love being in the inpatient setting. I like the high acuity, you know, the patients have, you know, very complex conditions. So it keeps me busy. The days go by quickly. And I really like that I get to see kind of complete ownership of the patients. So, you know, even if it's somebody who's had a liver transplant, if they come in for some medical complication, if they're within a year of their surgery, they're going to come to the surgical service. And so we get to see and be part of that workup, whether it's, you know, something infectious or something cardiac in nature. It's just really cool to see that and collaborate with so many different medical subspecialties.
Awesome. Anybody else want to go next?
Yeah, I can. Oh, go ahead.
Whatever you want, Karen.
Go ahead.
So I too, Anna already hit on a lot of these points. Always knew I wanted a career in medicine. Didn't want to spend a million years in school. No offense to the MDs, but I just didn't. And wanted that flexibility. So that's what initially drove me to becoming a PA. I love liver disease. I know that sounds really weird, but I do. I was introduced to it actually as a PA student on one of my ICU rotations, and it was just taking care of a cirrhotic patient. It was just fascinating to me. So that's how I ended up in hepatology. And then with transplant as well, like Anna said, it's so highly specialized, but it's a good opportunity to practice a lot of medicine, challenge yourself. There's never a dull moment, I think, in transplant. I think we can all agree to that. And just having, honestly, at MGTI, the camaraderie between PAs, NPs, our MD colleagues is just, it's something that you can find at other places, but I think it's one of the reasons that a lot of us stay here, in addition to, you know, of course, loving our patients and loving what we do. I think we really make up a great team.
Yeah, I was gonna say, I can definitely see that just from the the couple of times I've talked with you all, it's like you really do seem to enjoy your job and enjoy each other, which is great. And I think is great in any sort of, work setting, but yeah, that's great to hear. Karen, did you want to go next?
Yeah, I mean, I also would echo what Anna and Michelle have both said, that the flexibility of being able to switch specialties, not having to be in school and in training for years and years and years, definitely is part of the appeal of being a physician assistant. Specifically working in the Transplant Institute, it's one of the most fascinating and interesting specialties. And we didn't learn too much about transplant medicine when we were in PA school. So it really is something where you get a lot of training on the job and when you first start here. But there is no better feeling than caring for someone when they're at their sickest, in need of a transplant, and helping them get through that really difficult time, and then watching them walk into the clinic a few weeks after their surgery and they have a completely new life and they're feeling wonderful. And it's an absolutely incredible feeling to see someone go through that incredible transformation. And then one of the, fascinating things about working at MedStar Georgetown Hospital is our care is so multidisciplinary, and we coordinate with so many different specialties. And every single day I'm learning new things from my colleagues and associates in every specialty, because these patients are so sick and so complex. We get a lot of input from our infectious disease colleagues and, just every single subspecialty, nephrology and anything and everything that you can think of. So coordinating with the other specialties and learning from them has also been a really great experience, and just really enriches our learning.
Right. Yeah. It sounds like it's definitely a super rewarding job to be in. Andrea, did you have anything to add, or has everything pretty much been covered?
My story sounds very much the same. The only difference is I actually went to school to be a doctor. I took my MCATs. I was waitlisted in medical schools and everything. And in that interval of wait time, I didn't want to wait. I was tired of just waiting. So a friend of mine had said, hey, I entered this new PA program. Why don't you come shadow me for a day? Let's just see if you feel like it. And to know that I could get there that much faster and I could get hands-on that much faster, I fell in love with it instantly. I applied for PA school almost right then and there. Within months, I got accepted. I went to school. It was great. I didn't ever in a million years think I would be doing this. I wanted to do pediatrics when I first started. I moved from New York to Virginia while I was finishing off my education. So it was very hard as a student to get in to a pediatric facility where they were just going to suck you up and let you work there. So I started from the ground up and I did primary care like most of us do. And I encountered a patient with hepatitis C. And I've always been intrigued by HIV in general, just the idea of how this virus does what it does and how these patients really can be affected, that I kind of latched onto it. And I actually ran into a gentleman who comes from my hometown in New York, who happens to live out here in Virginia, had a hepatology practice. He said, if you're that interested, why don't you come work with me? And that's kind of how it worked out. And I've loved it ever since. I've been doing liver disease management. I was only a PA for 6 months before I started doing it. And I literally ran with it. And I did research and I did all these traveling things for hepatitis C. And it was just so cool to be part of something that was almost like curing cancer. And that's when interferon was out, because, that was like killing your patients and then sending them home and saying, good luck, I'll see you in a week. It's all completely different now. And to be part of that is huge for me. As part of the MGTI world, I actually used to refer to MGTI with my primary hepatology practice for liver transplantation. And when I did that, I would send the patients away and I would never see them again. And then it was sad because I was like, I did all the work, I got you there, and then I can't see you anymore. Like, what's that? And my doctor retired. And when he retired, I fell into MedStar's hands, literally. And I've loved it ever since. I really, as the person who kind of isolates from most of Georgetown all the time, just because of what our situation is, I still feel like part of the team. I feel like my opinion counts. I feel like when I need help, I'll text Michelle and be like, Michelle, quick question. Or Karen, can you check on so-and-so? They're inpatient right now. We share multiple patients, all of us. And it's constantly hey, have you heard from Mr. So-and-so? How's he doing? Is he okay? Or you know what? I put a new set of labs in there. Can you follow them for me? I mean, it's just, I expected that. When you work with a group of people, you get along with some, you don't get along with others, but we really do all very much get along, and we really are there for a common purpose. And I think it's great. It's unique that most of the APPs are female, although not that unique when you look at the NP and PA programs that are out there. Most of our medical providers are male. So it's a really unique dynamic that we create these cool relationships with each other, and we're so very different. And we do different medicine. I mean, I don't see fresh transplants, but I see post-transplants. So we all have a lot of commonality, but we're all so very different. And I just am proud of the work that we do. I'm proud of what we can do for people, and, you know, watching them go from their sickest to their most amazing thereafter, and the hugs you get and the accolade, and it is like nothing else. And you know, it's a little selfish, I suppose, but it makes you feel good.
Yeah, that's awesome to hear. Yeah, it's definitely, like I said earlier, sounds like a super rewarding job. And, you know, it sounds like you guys all, because you guys all get along so well, it helps you come to work, you know, excited, and then it makes your patients experience better. And it sounds like you all make a personal connection with each of your patients, which is just, that's great to hear. We've actually got a couple comments from our viewers thanking you guys for your work. Our first one's from Chenier. Sorry if I butchered your name, but they say, thank you ladies for your commitment to patients and representing our PA profession so well. Soba says, nurses love working with PAs. And Sarah says, all of you work so hard and are very much appreciated in the medical professional world. Thank you. And she put thank you in all caps. So I think you guys are, you know, people see the work that you all put in, and they're definitely appreciative of it. And so my last question for you guys to kind of wrap up our broadcast is, what is the message you'd like our viewers to take away after watching this? I don't know, Karen, do you want to start?
Sure. I think the key message that I would give you to take away is, if you have the opportunity to see a physician assistant, don't hesitate, because we are, you know, highly trained, competent medical professionals. We work very closely with our physician and NP colleagues to provide outstanding medical care for our patients. I am really proud to be a physician assistant. It's a privilege to work at the MedStar Georgetown Transplant Institute with all of my colleagues who are here today and everyone else who's watching. And thank you all for joining in.
Thanks. Anna, you want to go next?
Yeah, that's a tough one to follow. Great job, Karen. Everything was so well said. Yeah, I think that I would agree. If you have a chance to see a PA, don't hesitate. I think if anybody's considering a career in being a PA, I would highly recommend it. I'm always very excited to tell people what I do and why I love doing what I do. And I think, you know, everybody spoke to it. It's definitely a privilege to work alongside these colleagues and to provide the care that we do to our patients, and to see, you know, them really turn around, to go from, you know, having a disease that could end their life to, you know, once they're post-transplant, to have a new lease on life is truly an amazing transformation.
Right. Great. Thank you. Michelle?
Whatever Karen and Anna said, no. No, I do 100% echo what they said, though. I think, to add to their comments, you know, being a PA is, I think, that one of the most rewarding things that you can do. Also one of the most challenging. So again, saying what they said, if you have a chance to see a PA, it's awesome. If you want to be a PA, go for it. If you ever want to reach out to one of us, I think, Sarah, you're going to put contact information. So, and again, just working with a great team at MGTI just makes it even that much better. It's like the cherry on top of the ice cream sundae.
Awesome. And Andrea, sorry, once again, you get the short end of the stick of going last. So yeah,
it's okay. No, I couldn't agree more with everything. The one thing I think, if anyone's considering this career in general, is you can still have career life balance. All of us are moms. We have multiple children. I have school age kids, so my kids are in school and I can work with their schedules. I work with our schedules. We have some newborns. I mean, it sounds overwhelming to be in medicine in general, particularly these days with COVID and whatnot, but we rally against each other. We're extremely supportive of those choices that we make. And, you know, if I'm ill or if I need to be out for my little one, I call Michelle and say, hey, can you cover me today? And it's a vice versa thing. We really do spend time not just worrying about what we need to do for our patients, but making sure that our colleagues are also being supported so that they can do what they need to do for their patients. So, you know, again, being in this little family of amazing people at Georgetown is one thing. Being in a family of all of these PAs worldwide who do such good things for so many people in so many different specialties, it is an honor and a privilege. And, you know, years ago, this came from the military. PAs started in the military, and it was primarily men on the field when there was an injury. And then we realized how important and how valuable that resource was. And then it started to trickle down into regular populations and not, you know, military-based medicine. And it just has evolved. We're the #1 career for the last 4 or 5 years in a row. I mean, NP's on the list too. Don't get me wrong, they're #3. But that's impressive.
Yeah.
So I think when you look at quality of life, what you can actually do with what it is you've learned, it's amazing. And you learn every day, something new every day. It's not that your education stops when you get that license. It's like, oh my God, I never knew that. And now you get it. And then you pass it on to the next one. And you know, I'm one of those people that passes it forward. Always have. It's where I got it from my PA colleagues above me. We take students. We love students. It's hard with COVID, but we like students. So if anybody's interested or has questions about anything, please contact us. We will get you in touch with the people that need to get in touch with, and we will help you find a career just as blissful as ours have been.
Awesome. Well, thank you. I think that's all perfect way to end the broadcast. So thanks again to all of you all for joining today, our experts and our viewers. And we hope you're leaving this broadcast with a better understanding of physician assistants and all they do for our patients. If you'd like to learn more information about MedStar Georgetown Transplant Institute, you can call 202-444-3700. Thanks again for joining, and we'll see you next time.